Hello, and welcome to our next session, Solutions to Address Staffing Challenges and the Workforce of the Future. Today, I'm thrilled to be joined by a panel of experts in healthcare staffing who will be sharing solutions for attracting talent, addressing burnout, and tackling retention challenges, as well as the challenges impacting the healthcare workplace of the future. Thank you to our sponsors, American Physician Partners, SCP Health, AMN Healthcare, and Synergy Health Partners. I'm Steve Eck with Modern Healthcare, and I'm joined by a great panel today. So let's go ahead and get started. Each of you brings a unique perspective to the topic of healthcare staffing. So I'm really looking forward to hearing all of your insights and solutions for our audience. Our opening question, and we will start this one with Tony. Our opening question is just please introduce yourself and describe what you are seeing in your own experience with your clients who you work with as the biggest challenge in healthcare staffing. What is keeping healthcare executives, like our modern healthcare audience today, up at night? We'll start with Tony.
Steve, thank you, and privileged to be with you and our team today. My name is Dr. Tony Brenningstool. I have the privilege to serve as our Senior Vice President, Chief Medical Officer for American Physician Partners. And Steve, I think the question you asked is a really good one. You know, currently where we are in this post-pandemic phase, you know, what I think is really creating a lot of challenges for our healthcare executives and our hospital CEOs who we partner with is really just this overarching concern of how do I retain the team I have? You know, we all know that we've worked through this staffing challenge and where things have been with, 330,000 people leaving the healthcare workforce in the last 2 quarters of 2021. And, I think what they're probably struggling with is there's sort of depletion across multiple service lines, of both hospital-based staffing as well as clinical staffing. And I think that that's creating probably their number one concern. As you said, what are some of the things we're going to talk about today are strategies and solutions and things that we might be able to offer from our vantage points to our hospital partners about that. And I would say, the one thing that I would just encourage our team to focus on is culture, because culture is what's going to drive retention, and really creating a work environment that hospital-based employees as well as clinicians feel they can thrive in is really going to be the secret to success.
Great, thank you. And Michael.
Yes, thank you. Also a pleasure to be here. And Michael Foster, Executive Vice President, Staffing Operations at SCP Health, overseeing clinical onboarding and support. And like Dr. Brenningstool said, I think those are all great. I would just add sort of what keeps me up at night is some of the challenges we're all facing around staffing shortages, rising costs around payroll, and lower reimbursement. In addition, from my standpoint, I would say also how to create the best onboarding and ongoing support experience for the clinicians that we have working with us.
Great, thank you. And Larry.
Yeah, thanks, Steve. Larry Punteney. I'm Vice President of Workforce Planning for AMN Healthcare. It's also great to be with all of you today. And I think Tony hit it on the head. It's really about retention right now. I don't think it's hyperbolic to say that, the clinical workforce right now is at a crisis point. And, we've seen a nursing shortage since the 1930s, but this is different. This is across virtually all direct care roles. It's different because staff are leaving the workforce after 5, 10, 20 years in the profession. We've always had a high turn with new grads, but this turn with experienced and tenured staff is unique. I don't think there's a secret elixir here. I think it's going to be a combination of workforce environment, flexibility in roles, comp, benefits. Tony mentioned, culture trumps strategy all day long. So unique care models is going to be key. I think it's going to take a coordinated effort from the C-suite and a focus on this to get us, to a post-pandemic state where we're stable with the workforce.
Good point.
Great. And Dan.
Yeah, hi, everyone. Dan Siegel. I'm the CEO of Synergy Health Partners. Excited to be here today with Tony, Michael, and Larry on this panel. I feel like I'm going to learn a lot from all of you, as well as contribute what I can here. Just real quick, just in terms of what Synergy does, we were actually founded by 2 orthopedic surgeons that, in their own practice, were exhausted and frustrated by what they found it was an inherent care conflict between their private practice and taking emergency on call. And so they were called in the middle of the night. They had to cancel their elective cases the next day, and they just always were trying to juggle a schedule, and it left patients either uncovered or upset. And obviously it wasn't great for the hospital environment either. So what we typically get from hospital administrators in terms of what keeps them up at night is exactly that. They've got gaps in the surgical on-call panel, and they're really trying to figure out how to fill them. And if they can't, patients are out migrating to other facilities, which is obviously not great for patient care and not great for their operating revenue. We kind of call it the clinical churn and financial burn. So we're really focused on trying to put together teams of surgeons that can fill those on-call emergency gaps.
No, great, thank you. So to support some of the data you've already mentioned, I want to share some additional healthcare industry data just to situate and level set this conversation. Staffing strains have affected hospitals and health systems across the U.S. during the COVID-19 pandemic and beyond. Here are a few data points showing workforce shortages and how they are impacting hospitals, as cited by the AHA. Since February 2020, hospital employment has declined by nearly 94,000. Staffing shortages have cost hospitals $24 billion during the pandemic. Amid increased demand for healthcare workers, there will be a predicted critical shortage of 3.2 million healthcare workers by 2026. So this is a huge topic in healthcare, a huge topic of importance for the modern healthcare readership. So we really appreciate you giving your insights on this. In light of this data, our first question, or a second question, is what are creative ways hospitals can explore to attract experienced and new caregivers and clinicians? And this time we'll start with Dan.
Sure, Steve. Yeah, all the data you shared is pretty staggering when you really stop to think about it. I mean, there are so many numbers that are thrown around these days, but when you kind of look at them on an individual basis, it's huge challenges that we're facing collectively. So good to have these conversations. So think about it. I kind of mentioned a little bit about Synergy's approach. We were basically one of the pioneers in kind of a new staffing model called a surgicalist model. So the simplest way to think about it is kind of like hospitalists for surgery. So dedicated surgeons that cover the on-call panel. For the last 10 years, we've been partnering with hospital administrators. And essentially what we do is we recruit and manage teams of orthopedic and general surgeons so that patients make sure that they get local surgical care when they need it most. Obviously better for both patients and profits. A lot of people ask if we're locums. We're not locums. What we do is we actually put these programs together that are dedicated and integrated part of the care continuum on a long-term basis. And so they become kind of part of the fabric of the community. The benefit for the surgicalists themselves is that they work 10 days. They take all the call for that 10-day period, and then they go home for 20 days. So it restores work-life balance for them. We have surgicalists that are training for Ironman, that have climbed Mount Everest, that get to coach their kids' little league teams, that can make coffee for their wife or husband in the morning. So many of them really thank us for restoring work-life balance for them. And what that means is that you've got now rested and restored surgeons who can deliver the best patient care. So that's our approach to kind of an innovative way of creating care when it's needed most.
No, thank you. And Tony, what are your insights on that? Attracting experienced and new caregivers and clinicians.
No, really good question, Steve. And Dan, I want to just highlight something you shared because I think it's incredibly important, and that is, showing, creating and facilitating balance in our professional lives. And because where there's balance, there can be a sense of renewal, a sense of refreshment, an opportunity to then attack the challenges that come in practicing medicine and working in a healthcare environment. And that allows us then to have more resiliency and certainly more stamina to navigate the challenges that we're in right now. And so, work-life balance, professional balance is critical. And I think it ties back in, Steve, to the question you'd asked is, what are the strategies to retention? What are the strategies to be able to build the workforce that you need in your individual hospital to be able to meet the care demands for the patients who are caring for? And first, I'll touch on how I think hospitals can do that well, and then I'll touch a little bit on what we do as a company. But I think, it really gets back to how do you resource the team to be able to have the ability the tools in front of them to be able to execute their job well. And so there is so much pay pressure. There's so much compensation components. There's a lot that goes into, just can you meet the financial demand of getting the team in place? But I think the real challenge and the real secret to success is showing yourself that you're a differentiator in being able to attract talent by how you'll support them, how you'll resource them, how you create a work environment that's sustainable. And then number two, how you value their work-life balance. And then number three, that all drives retention. And then really that's the retention focused strategy. And I think the other piece of that I would emphasize is we can't underestimate the power of wellness, the wellness of the caregiver, the wellness of our caregiver team. And here at American Physician Partners, we put that as a top priority. As a patient-centric, provider-centric company, we put provider wellness at the top of our list of our priorities for how we take care of our provider team. We have a wellness fund for our team. To each individual physician has a wellness account they can draw from it and utilize those dollars to help contribute to their individual wellness. We do wellness education in support of our team to help create I would say, infuse professional resiliency or give them the tools they need to be able to work in the environment that they're in. We work with our hospital partners to create departments where there's collaboration, teamwork, there's cohesiveness amongst the care processes so that we can really create a patient-centered care experience. But all the caregivers involved in that, whether it's our emergency physicians or the nurses or the techs, medics, HUCs, LPNs, nurse practitioners, advanced practice clinicians, whoever's a part of that caregiver team, all brings value. And each person has a role. We want to make sure that we're doing our part to not only support them in their role, but really lead the way by taking great care of our APP provider team. But I think it all comes back to really that key ingredient of us as leaders making sure that we can lead to creating a work environment that's sustainable to navigate the challenges that exist right now.
And Michael, what are your thoughts on that?
Well, a lot of great ideas there. Tough to go at the end here, but sort of what I would add too, from just a recruiting standpoint, is trying to connect with clinicians through different channels than we maybe have historically, right? I think everybody's done a lot of virtual events and become very good at that over the past couple of years, but also focus on maybe getting back to in-person events and then communicating with clinicians, right? There are some that, as you're engaging, prefer text message versus email versus phone call. So just kind of understanding what's important as you're trying to attract talent and how to best communicate and share your values. And the other thing I would add is sort of working to remove administrative burdens from clinicians so they can focus on patient care, I think is a great way to attract and draw people into your culture and your company. No,
thank you. And Larry, do you want to comment on that, or we have a special question ready for you if you want?
I can comment quickly. I think what Michael's saying is remove barriers, right? And I think one of the barriers that has existed is this rigid approach to the way we believe we have to staff our units and the hours that the nurses have to work if we're talking about bedside clinicians. So I think flexibility is going to be so important. And Steve, you mentioned off the top, the ANA and AHA recently had a paper on creating flexibility internally within healthcare systems. So how can we create internal travel programs for for staff that don't want to leave the organization, but see a real benefit in the pay that's being offered right now in the travel world? How can we be more flexible in the type of work we provide? There's some really terrific pilots going on across the country. UC Health in Denver is doing one right now where they're looking at special tech assignments where they have nurses who are covering 72 beds and only dealing with the technology at the bedside. It's removing 10 hours of work per shift. So there's some really innovative stuff that's going on. And I think, watching what's going on around the country and what's working is going to be, it's going to be important in creating that type of flexibility that staff want.
Steve, can I add on to what Larry shared? I think it's really,
of course, Tony.
Larry, I just want to really underscore what you said, because I think the care team and what it looks like going forward is going to be different than what it's been historically. And if we think about, I think for our modern healthcare leaders, being on the cutting edge of innovation, of flexibility, of the things that you talked about, recognizing that the makeup of our care team is going to change. And how do we leverage different components of that care team to all the things that Larry just talked about is really going to be a strategy for success going forward. We call it multidisciplinary care team. So how do you let a nurse function at the highest level that they can? And then how do you support that nurse with medics and techs and LPNs and aides and different things that really help them be able to take away some of the less important patient care tasks and allow the nursing team to function at the highest level of their license with the physician caring for the patient. And what's interesting is this really is going to drive and improve patient experience, because there's more patient touches, there's more people part of the care team, there's more people engaged in that patient encounter, and patients perceive that, they feel that translates into value, and that's going to generate not only loyalty to that healthcare unit or institution, but certainly going to drive more higher patient satisfaction scores and an awareness of the care team it's done. So, Larry, I thought what you brought up is really powerful. I just want to make sure I had a chance to underscore that.
No, thank you. And it's interesting, all of you mentioned in your comments how important workplace culture is, environment, work-life balance, caring for the caregivers. So to Larry, what are some benefits that healthcare providers can offer their employees that will keep them and retain them?
Yeah, it's multi-pronged, right? And so we've seen some really innovative things working within some of our client environments. I mentioned UC Health earlier. They're also experimenting with a tuition reimbursement program. But it's not really, not only is it reimbursement, but it's more on the front side of they are paying for tuition for individuals who are agreeing to work within their facility. So they don't have to go through the loan approval process. They don't have to go through, the federal approval. They're just paying for it up front, a real benefit to frontline staff with, some agreement that there would be some retention on the back end. In addition, I think you're starting to see some benefits beyond what we would typically consider traditional. Try to create this sense of community and this sense of belonging to an organization. So it may sound strange because I certainly don't want to infer that a ticket to an event somehow balances off what our frontline staff are going through. But those type of things, especially when you feel engaged in the community, are having a real benefit. So they are purchasing blocks to sporting events or blocks to certain events to create this kind of ownership and belonging to the organization that have, it's been beneficial. Those are, just a couple. I'm sure the panel has many others.
And anyone want to contribute some ideas for retention benefits?
Yeah, just to add on, I mean, I think things like that go a long way, Larry. It might seem small or trivial, but just having some time away from the work environment with the team to get to know one another does create those lasting bonds. We've also just seen things around, just the appreciation for the workforce. It's not. We all know it's not all about compensation, right? I mean, that's just a piece of the overall level of satisfaction. So, for a lot of our clinicians, just being part of something bigger than themselves, for feeling like their work has purpose, for being able to put purpose into their clinical work, but also into their own passions and their own family, and have the time to do that. Especially with the pandemic, it's been hard to find a minute to train on new technologies and to get, a break from the pajama time of having to put, to spend time entering data into the EMR. So just being able to pull back a little bit and give folks a pause and give folks a little bit of breathing room to enjoy those ball games and those, little dinners with family really does go a long way.
Yeah, and if I could add, Steve, just quickly, Dan, you mentioned it, but it's interesting. The advisory board did a survey of 1,000 clinicians back in the spring across all healthcare roles, and what they found was that yes, benefits and comp matter, but the work environment continues to be the primary reason that staff are leaving. And so I think too often we're getting caught up in this, hey, travelers are making X amount when they travel, and we have to offer that to our staff. If we can create a terrific environment for our staff that is supportive and provides the things that they need to be engaged, that's when that retention will increase, and that's when we'll start seeing some real movement.
That is a top priority, and looking at the environment of care, and I know we'll talk about technology in a minute, the role that plays, but just tying all these things together, as a physician, it's the small tokens of appreciation that mean way more than anything else. It's like Larry said, it's tickets to the show or ball game tickets, or it's just a thank you note, or it's just a pat on the back, or it's just seeing the administrator in the department there next to us caring for patients and just saying thank you for working so hard today to help make sure that we could get everyone cared for in a timely manner. It's the takeaway is it's the small tokens of appreciation that really drive are the secret ingredient to retention, because that really does facilitate a culture of belonging, a culture of connectedness and value. And that's where, professionals want to work in. It's not about salaries. Salaries will not retain anybody for a long period of time. It's all about the culture, the environment that you're in. Do I feel like I'm a part of a winning team? Do I feel like the team I'm a part of is winning in the patient care experience? And do I feel like my contribution to that is valued? And if you can convey that in any small and thoughtful way, but in an intentional way, it will give you a competitive advantage in retaining the team that you have and attracting new talent to the team as well. And just a quick aside here, our company, we created a culture that physicians want to work for. You know, we're an emergency medicine company and we do hospitalist medicine, intensive care. And we created that culture intentionally because we know what it takes to build a winning team that can drive a winning results in the patient care experience. And we know what winning departments look like and what the ingredients are that go into that. And so if that's in core to the DNA of what your leadership is, as you provide that to the team, then the end results of that are naturally going to be positive and naturally be what you hope them to be. And at the end of the day, it drives retention, it drives competitive recruiting and being able to attract the best and brightest in the industry. It allows us to be able to put the right teams together in the right format and the right structure that allows us to actually win the patient care experience. I think all the things that Dan and Larry had talked about are so important, and they're the small things that don't cost much, but they require intentional leadership to achieve.
Hey, Tony, just curious, because as the physician here, the doctor here with us, one of the things we've noticed is this sense, you mentioned not feeling appreciated. And I saw this kind of crazy statistic that doctors in the US, only 16% of them feel that the government appreciates what they do.
Right.
And less than 50% of the general public appreciate what doctors do. So, I don't know how that plays into this general sense of, just feeling a little bit both burned out and maybe kind of a waning sense of purpose. I don't know if that's something you've come across. Just curious.
Oh, Dan, I appreciate you bringing that up. And actually, I'd broaden that out, and I would just think about what we just lived through the last 2.5 years with a pandemic, right? And we went through a phase in the pandemic where all frontline healthcare workers were praised and appreciated and held in highest regard. And now look where we are now, where there's it's almost I don't think that is dissipated, but it's what we're faced with now is all the other healthcare challenges and pressures that are squeezing, on the system are creating now just competing priorities or creating stress that has to be managed. And I think the secret to that is remembering how important it is to say thank you and value the workforce that's delivering the care to the patients, to our nurses, to our physicians, to our APCs, to everybody involved in that. And I think, for healthcare leaders to keep that as the number one, sort of keep the main thing, keeping that as the top priority. And then what happens is when you take care of the top priority, which is the team taking care of patients, then all the other things start to fall into place. Doesn't mean the challenges aren't there. Doesn't mean they're not real. Doesn't mean we have to work creatively to navigate them. But they'll find their priority and they'll fall in place. And I think it's important as leaders for us to always remember to keep the main thing, and that is our clinical care team that's delivering exceptional patient care to each patient that comes to us for care. And then, but you did touch on something I think it's important. Michael touched on it earlier. The payer reimbursement system and that we're in right now undervalues the care we provide, and it's unfortunate. As an emergency medicine provider, providing life-saving frontline care to our team. But unfortunately, the reimbursement system doesn't always value that care experience, that expertise, the work that goes into those critical decisions at the point of care when it comes to reimbursing for that care down the road. And so, I do think that that's a real challenge. It's something that we in healthcare have to all work together to navigate. Hospitals will not be able to shoulder the burden of healthcare expense without better reimbursement structures going forward. And I do think that is something that that may be another panel discussion for down the road, Steve. But I think something that we all would, I think, find value in, that ways that we can really help address the payer system.
Yeah, great, thank you, Tony. And since we're already talking about burnout, we're gonna go to Michael. How can organizations address burnout at the individual level to ensure resources are available when needed?
Sure. So I think at SCP, we've invested in strong clinical leadership, medical directors, group medical officers, and I think a lot of the other panelists talked about the culture, right? And I think it starts with that leadership culture, trying to create a strong culture, driving a culture of quality with a team-based focus centered on patient care. And I would add to that, from my standpoint, being sort of staffing ops and a support, it's a privilege and an honor for me to sort of work for clinicians, right? And so I appreciate you, Dr. Brenningstool, and all the clinicians that we work for. And it really is an honor. And so what we try to do from sort of a staffing ops standpoint is invest. And like I said earlier, how can we create a better experience for our clinicians? Onboarding. We've recently done a lot in investing in lean process improvement. So how do we remove administrative burden from our clinicians? We looked at our recruiting process, our credentialing process. all of those types of things. So how can we reduce some of the touch points and make it easier for a clinician to get to where they need to be, which is providing the patient care and not have to deal with maybe as many people or as much paperwork. And so that's something that sort of, I think, is a big obstacle that people like me can do and my team can do to help support the clinicians. And again, it's an honor and a privilege every day to do what we do. And I'm thrilled to be a part of it.
Great. Thank you. And Dan, anything to add about addressing burnout?
Yeah, I mean, a lot of great ideas have been put out there. You know, we try to kind of bring it back to kind of the basics of what causes burnout. You know, sort of the ABCs of burnout from our perspective. So we talk about kind of autonomy, balance, and clinical outcomes, right? Those are our ABCs. So from autonomy, it's also really agency. It's that feeling of kind of ownership over your schedule. It's having flexibility. It's having predictability. Again, I talked earlier about the idea of being on call and never knowing when that proverbial beeper was going to go off. And that creates a lot of stress for folks to always just be wondering when they're going to get called in. So by putting predictability into the schedule, it allows folks when they're on, and when they're off, they're really off. They know they can rely on that, on that time for themselves and for their family. I think mobility also these days, people want to be able to move around and, you know, have a nationwide network of opportunities in terms of where they want to work. Then a few folks have mentioned this idea of kind of career development, career advancement. So you're part of an experienced team, but you're also learning new skills. And I think over time, as patients take more ownership of their healthcare, that, you know, physicians are going to be more partners and helping kind of guide through, you know, artificial intelligence and reading data and technology and really kind of being a part of the care continuum as opposed to kind of just guiding it solely. So that's kind of the autonomy and agency. I think, you know, we talked about balance. I mean, that is, I think, probably the biggest challenge. So, you know, we think about it as sort of competitive pay and time to play, right? You really need both. You know, many older physicians want to stay in practice, but they just, you know, don't want the administrative hassles. They don't want the burden of running a clinical practice. They don't want the ongoing stress day in and day out. And younger surgeons who are coming up, the millennials, are not interested in sort of the grind 24/7 anymore, but they want to kind of pursue clinical passion and personal passion. So, and the last, you know, one I'll just touch on is just obviously the clinical outcomes, right? To get into this profession, obviously, you know, Tony can speak better than I can, certainly on this topic, but the surgeons that we work with are really, they want to be part of a coordinated care team and a fully staffed care team. So it doesn't create this vicious cycle of, hey, I'm sticking around, other folks have left, and now I've got more work to do. And that creates even further burnout. And they want to be part of the conversations. You know, the reimbursement structure, I agree, is really challenged because what it forces hospital administrators to do often is at least create a perception of caring more about cost than care, which we know isn't true. But that perception may exist among some clinicians in terms of how certain decisions are made. So I just think bringing more transparency to how things are determined, inviting clinicians in to help make those decisions, providing time for, you know, tech training and being involved in, you know, just supporting those clinicians in terms of how the outcomes can be better fostered, I think goes a long way.
Really well said.
Oh, great. Thank you. So now we're going to talk about technology. And we're going to start with Larry. Get Larry in here. How can technology help improve the experience of healthcare workers and keep them engaged? If you have any thoughts about implementing technology and how staff can embrace technology, those would be appreciated too.
Yeah, I think, you know, we have to be careful with technology, right? You know, we hear that the implementation of an EMR and electronic medical records that, you know, providers are now, that they'll spend significantly less time in front of, you know, technology than they did before. It's going to make their job easier. And what every study has shown is we're actually spending more time in front of EMR and entering, you know, data. When we moved in that direction, it was supposed to streamline the process, right? So I think the studies clearly tell us otherwise. So technology, yes, it can be a big help. I think it really just has to bring efficiency for frontline staff. Integration is another key point. If you don't have an integrated device and you're not communicating with the other technology that you have, then that's a problem. That creates additional workaround and additional work for healthcare providers. So I think it has to work with what is already in the environment. It has to be integrated, easy to use, and it can't take more time. There's some really interesting things being done with technology right now, just in terms of identifying issues with the bedside. I right now find, it's interesting that many of our nurses spend so much time at the bedside taking vitals. And yet all of the research shows that it's the trending of vital information that identifies future problems. It's not the constant taking of that. So how can we use technology to monitor vitals and provide us that trending data and return time to the clinicians? So I think there's absolutely progress to be made with technology if it's the right technology and it actually is beneficial in saving us time.
And Tony, technology, helping improve the experience of healthcare workers and keeping them engaged. Any thoughts on that?
Yeah, it's good. I think, I'm just going to highlight what Larry had said, and Michael had touched on this earlier. I think the secret of technology is leveraging technology that helps facilitate ease of providers to be next to patients, right? To be in the caregiving space and not pulled away from the caregiving space. And so whether that's any component of the healthcare team, and it's interesting, EMRs, as Larry touched on, were, helps convey and store and communicate information on a broad spectrum, but the utilization of getting that information into the system is cumbersome. And so, that makes it hard. And that's what the competitive pull is away from the patient or away from the bedside. So, our sort of philosophy on technology is we want to be innovative and flexible. We want to leverage all the technology we can that frees up time so our providers can be next to patients or can be seeing patients and delivering care, living in that care experience space. And by doing that, I think is good. So there's a lot of things that are really good. So voice activated order systems, or utilizing scribes, or using advanced order sets and different things to create standardization in care. Looking at ways we can use technology to leverage rounding lists or create different things for our hospitals, our intensive care unit teams, different things that help just have them have more ease of being able to do their clinical or use their practice, ease in clinical practice, as well as facilitate time at the bedside. So I think those are really the two secrets. And I think the simple formula is the technology going to help achieve those two things? And if it achieves those two things, better work environment, more time at the bedside, then it's probably a good solution. And we'll leverage that or want to encourage our hospital systems to leverage that. And then the last thing I think it touches back in on what Dan talked about is so much of this is about workspace environment or the work environment, and how do we facilitate an easier work environment for our team, because that does drive retention and professional satisfaction. And I think we have to always be looking at the work experience and the work environment and working with our hospital partners to see how do we optimize that, so that we can communicate value to our caregiver team that we are doing these things so that it can be less of a burden on you, so that we can free you up to provide better patient care.
And Michael, your thoughts on technology and implementing it so it really doesn't become a burden or a hindrance to the process?
Absolutely. And SCP has done some great stuff around this. I think, like we talked about, just using technology to utilize the burden. And one great example is using artificial intelligence to help with coverage models and staffing. Rob Riley, our Chief Operating Officer, just put out a great white paper on investing in AI that covers some of this. But it's really about SCP Health applying AI and other tools, proprietary tools, to our clinicians, allowing them to focus on that and reduce administrative tasks. We have a digital clinical experience platform that gives opportunities for clinicians to also see patients outside of the four walls of the hospital through virtual care, direct communication on scheduling, and many other features. So our IT leadership and operational teams have done a great job partnering with our clinicians to find ways to use that technology to do just that and make it easier. And I think, like Dan said earlier, just to tack on, work-life balance is important to clinicians, just like to the rest of us, right? And how can we focus on helping make that easier for them, aligning to our core values on things like collaboration and partnering with clinicians to do that, and being creative, right? So at SCP, we're including virtual health and dynamic scheduling where possible to reduce burden. And I think what that does in summary too is creates a better staffing mix for our clients, helps us reduce costs, and gives the clinicians more flexibility.
Steve, if I might just to add one quick, couple of quick comments.
Yeah,
totally agree. I think Larry and Tony and Michael, you guys all touched on it. I mean, things like the EMR, the promise of, creating more efficiency, and certainly from our perspective with our surgeons, we definitely see, a huge administrative headache and hassle, and the interoperability that was originally promised isn't there yet between the various systems. The other thing that I sort of wonder about, I don't have an answer to it yet, and I think it remains to be seen, is the promise of technology hopefully will solve a couple things. It'll solve sort of equity, which is access to care, especially in remote areas, remote parts of the country and the world, and hopefully it will be efficient and improve economics as well. But on the first part, on the equity, I don't know, maybe for another panel topic, but just kind of interesting to hear if anybody has any thoughts on I've read things that will actually create potentially more disparity between folks who have access to technology and folks who are in the kind of wealthier income brackets versus those who don't, may actually get left behind. And as technology gets more and more sophisticated, both in terms of physicians keeping up with technology and patients being able to understand what's happening with their own data. Just curious how we keep up with that technological trend, if anyone has any thoughts on that.
Anyone care to comment on that?
Or not? Next time.
Dan, I would tell you it's absolutely a challenge. In fact, some of the technology that we provide, and I think many organizations provide, requires an app on the phone. And some of our frontline care providers in some of the more difficult areas don't even have access to that. So the access to technology and healthcare systems needing to provide that is, it's a real challenge.
Yeah, I would just add too, I think, and I see this from my standpoint, is making sure that it's being used across the spectrum and you're getting collaborative feedback and input. So, the best technology, if people aren't using it and embracing it. So I think it's kind of making sure that you're creating standards that can be of maximum efficiency to the users so that they welcome it and want to use it and take it on, because it'll make it easier for them.
Dan, one other thought about that too is, one of the challenges we're experiencing that we work to do is we have some really good technology tools that do actually achieve some of the ease of clinical practice and facilitate things, but they're tough to get through our hospital-based firewalls. And so sometimes what's challenging is there's individual domains of security that need to be maintained, but it's hard to get crossover. And so that we have our APP provider portal, fortunately can't be accessed within the four walls of the hospital because of it not being recognized by, within a safe domain of that and different things there. So I think the secret is not only leveraging technology that is useful and benefits the end user, but then us working together as leaders to make sure that the technology works well together so that it can be accessible at all times of the day so that teams actually can benefit from it by utilizing it. And then, app-based technology, Michael, you talked about that. I think you guys have done some really, really innovative things there. But I think it's how can we make it as easy and user-friendly as possible for our team, because then the adaptability of it will happen. And when the adaptability to it is there, then you can actually realize the benefit of the investment of putting it together for a team. So, which then drives what Dan has talked really well about is then the physician's emotional connection to the tool that was put to them, which then communicates value and can drive more professional and personal satisfaction. So all these ideas are linked together, but I think our challenge as leaders is figuring out how do we unlock some of the challenges so we can connect and link things together and really leverage the maximum benefit for our caregiver team.
I would just add one thing too, Tony, and I completely agree with what you said. And I think it's incumbent on us as partners with the healthcare providers and with healthcare systems to make sure the utilization is where it needs to be, because it's one thing to implement, it's another thing to utilize, right? And so if we're not putting in processes and workflows with our client base to utilize in the right way the functionality that exists, then it's lost.
Okay, thank you. Now we have a question for Tony. One of the hardest hit specialties by the pandemic was emergency medicine. What are some of the unique challenges hospitals and practices are facing with respect to recruiting nurses, physicians, and advanced practice providers in the ED? And what are some effective solutions you've seen?
Well, Steve, that's a great question. We could talk about this for a long time, but I think, the challenge has been is when you think about all that we lived through with the pandemic and what was required of us on the front lines to help navigate the care experience to make sure our hospitals were well positioned with best in class protocols to care for patients safely, to provide the right care coordination and continuum of care for patients, aligning that across specialties, all the things that went into caring for that. It took an emotional and physical toll on a team. And whether that was the emergency medicine physician or the emergency APC, advanced practice provider, or the nursing team or everybody else who had a hand in that care experience from EMS all the way through, I think it's important to have a realization that there is a significant emotional and physical toll that each one of those individuals endured and survived. And unlike anything else, it just requires a recovery period. And I think what we're seeing right now is some of that. We're in that recovery period where some people are just needing to take some time off, take some time to step away from that experience and just recharge. And so I think for us as a company, we've been very thoughtful about this right from the very beginning. I think back to what I was doing back in February when we saw the first kind of hints of this coming 2.5 years ago and what that was going to look like to where we are today. I think it's important, at least for what we try to do with our care team, is communicate consistently that our team, that we support our team, that our providers are at the center of our decision making, that we value and appreciate the team that we have, and that we have an obligation to provide point of care to our communities where we're privileged to practice. But I think you can't underestimate the power of teamwork, the power of good frontline leadership, the power of acknowledging and recognizing and celebrating each individual who worked to participate in that and the successes that they achieved for their community, for the hospital, for patients that they cared for. And I think all of that just ties back into a winning team culture. And I think the secret to really navigating the pandemic well, or to restoring the workforce in our hospitals, or what we're trying to do with our hospital partners that we work with, is really all centered around building a winning team culture in the department. Because when you build a winning team culture, you can attract great talent, you can retain great talent, and the talent that you have works well together so that it's a seamless, coordinated, one team approach. And patients feel that, they appreciate that. They know that they're in an organized, aligned, and coordinated care experience, or when they come into a very frightening place called the emergency department. And by us being very intentional as leaders and being very focused on that culture, connection, and alignment within the team, really does, I think, give our hospitals a competitive advantage to be able to retain the team they have, gives them the ability to recruit into that team because they can celebrate the care experience that's there, the coordination of that care experience that's there. And then we can continue to further move forward and do that. And I think I would just summarize and say that, I think Michael and Dan and Larry, and not only just us on this call, but many of us in healthcare are all doing this in a unique and special way in the areas where we touch patients or we interact in the patient care experience. And I think that the collective ways that we're doing it together is going to ultimately help healthcare move forward, not to mention what our healthcare leaders are doing, both on this call and in other aspects too. And so it's a collective effort of all of us to just be very intentional in our leadership, to put our providers and our patients first, and to be thoughtful and aligning around a winning team culture is really what's going to drive success going forward.
Yeah, and Tony, I think emergency medicine is really unique because of the stresses that were put on those clinicians, those life-saving folks during the pandemic, and I think we're still experiencing the aftermath of that. I mean, read statistics that as many as 50% of physicians are still considering leaving the profession in the next couple of years. So it's not like we're out of the woods yet, right? The folks that are, as we talked about earlier, the folks that are still there are bearing the brunt of the load. But as more people potentially leave the profession, that could create, even a more difficult situation. There was, a quote somebody shared with me just about, to your point, Tony, on just appreciation of the healthcare, the emergency healthcare workers. I'll just read it real quick. It said, with COVID, it was made clear our employers don't value us as they don't seem to care for our health and safety. For example, mid-COVID, they told us that our productivity had to increase again. I get that healthcare is a business, but it was so stressful thinking about RVUs in the midst of COVID. So again, I think everyone's interests ultimately are aligned, but I think there is some disconnect in terms of communication and how, clinicians feel appreciated and how hospital administrators obviously have a job to do to make sure their hospitals are solvent so they can keep their doors open for patients who need them. So still some work to do there for sure.
Michael or Larry, any comments on the emergency department and their unique challenges?
I mean, I would just say we at AMN, we have 20 to 30,000 clinicians on assignment across the country at any given point. Without question, the ED is, the most difficult place, not only to staff, but to engage the clinician. And so as we went through the pandemic, one of the things that AMN recognized was support for those clinicians needed to have a heightened awareness. So an entire workflow process was put into place. We were consistently reaching out to those AMN employees who were on assignment across the country to check in on their well-being, to check in on the family, to communicate with them, to make sure that they were having good balance. How are they stressed? We had one clinician not show up for work, and we, reached out and were able to manage the situation and get her back, to a place where she was able to get back to providing, care. So it is challenging.
No, thank you. Well, we started out this conversation with some very daunting statistics, and after listening to all of you, I hope our audience is encouraged by your optimism and solutions and hopefulness of the situation. So that being said, we're going to have a final lightning round question, keeping in mind that the theme of this is to provide solutions for our audience here today. But please give the audience one piece of advice or provide a solution for how to engage and retain the workforce of 2022, keeping in mind that the needs of their organization have changed dramatically since March of 2020. And we will go back to our original order and start with Tony. Just one piece of encouraging advice. We'll end on a really hopeful, optimistic note here today.
That's good. I guess I'll just summarize in culture is everything. So focus, be very intentional on building a winning team culture in your department, in your hospital, within the area where patient care is happening. Unite the teams together around a patient-centered care process. And I think that is the secret to success in recruiting and retaining and ultimately driving the clinical care quality results that are necessary, but certainly the financial performance will follow. So you can't ever underestimate the power of teamwork.
Thank you. And Michael.
Yeah, no, I would add again, I think we all kind of touched on culture and leadership as key things. And so I think you have to invest in that, right? So I know we've had recently, getting group medical officers together in person for conferences where they can strategize and to train and develop them as leaders as well, right? And so I think that's an important thing. I think that ties back to what can we do as companies and leaders is kind of, again, invest in those clinicians as leaders so that they can create and drive that culture. And then again, I think, the delivery of care needs a lot of different parties involved to help fix the system. And I think that's also part of making sure it's sometimes seems very one-sided. So making sure all parties are involved in helping fix the system as we move forward as well.
Well, thank you. And Larry.
Yeah, Steve, when you said lightning round, I hope you meant you wanted some shocking and not quick.
No, not quick.
This may be winded.
We like all your examples. You think?
I think at AMN we really help healthcare systems from the beginning of the planning process. When you're doing predictive analytics and AI around how many staff do you need, what kind of core, how do you build out float pools, how do you stand up central staffing, share resources across an organization, then provide clinicians on the back end, make sure that they're having a great experience, that their well-being is taken care of. So it's really it's a holistic approach. But I would say that in technology and app development, there's this process called MVP, right? It's a minimum viable product. So what is the minimum viable product? Develop it, get it to the market, get the feedback, create an iterative process where the market is providing that user feedback and actually developing a solution for you. And a CNO recently explained, I've tried everything. I've put fruit on the floor. I've tried candy baskets. We had a wellness room. We did a breathing app. At least I know what isn't working. Still looking for what will. And I think creating that kind of environment where you are engaged, you evolve, and you take action, but you have to have a plan around it, right? Mm-hmm. Not a meeting, not a discussion, but action. Show the staff that we're actually doing things.
It's intentional.
Oh, that's great. And Dan.
Yeah, hard act to follow there, Larry. But I like what you said. I mean, there's so many big ideas. At Synergy, we try to be the easy button for our hospital administrators, and take fairly sort of simple approaches. What I'll share now is it's not necessarily a novel idea, but it's taken me, I've been leading high growth companies for 30 years, and I always, almost on a daily basis, have to remind myself that sometimes slowing down actually helps you speed up. Mm-hmm. And so, taking time to talk to your clinicians, to discuss what excites them, to talk openly about what concerns them. Over time, it's not an overnight thing, but over time, it does. That honest dialogue I've found actually builds trust, which is the key to any long-term relationship. And so as you start to open up and they start to open up, you actually generally get incredible ideas about how to improve your culture. So it really is a very sort of bottoms up approach, and let those great ideas sort of sift up as opposed to trying to kind of impose ideas upon them. I've found over time you do earn a very productive, engaged, and loyal workforce. Obviously, from Synergy's perspective, kind of taking an expert in surgical staffing to fill emergency on-call gaps, we believe is a simple way to kind of demonstrate ongoing commitment to the well-being of the team and make sure you have the right staff in the right place at the right time for your patients. So that's my contribution.
Great. Thank you so much. And that takes us to the end of our time today. I just want to thank you, Tony, Michael, Larry, and Dan, for so generously sharing your time, insights, and solutions with our audience, and really providing some optimistic, hopeful suggestions that our audience can go and implement in their own organizations today. I'd also like to remind our audience that each of our speakers today have provided some content assets, more information about their organizations that you could download from the conference platform. And thank you to our sponsors, American Physician Partners, SCP Health, AMN Healthcare, and Synergy Health Partners for their support of this session and for the support of this event. For more information about our sponsors, please check out the conference booklet on our microsite. And thank you to our audience for joining us today, and please enjoy the rest of the virtual briefing. Thank you so much.
Thank you.
Thanks for the privilege to be here today.